Now let's talk about fructose metabolism. So this metabolism we are talking in context of hepatocyte, because hepatocyte has a special enzyme for metabolizing this fructose. These two essential enzymes, one is fructokinase and second essential enzyme is this aldolase B. So because of this two enzymes, this fructose metabolism is uncontrolled metabolism, uncontrolled metabolism. So horse without this uncontrollable pathway, it becomes an uncontrollable pathway because it passed through a very important regulatory step that is called phospho-PFK. So it is like uncontrolled horse. Once you eat fructose, zoo, it will convert into this glycerol. You consume, it will convert into glycerol and fat. You convert it, it will convert into immediately it will convert into glycerol and fat, because it has its own enzyme which is not regulated. Okay, which is not regulated. That is why it will immediately convert into glycerol. So there are very two specific enzymes that will not be under control. And remember this two enzyme. Fructokinase will convert fructose into fructose 1-phosphate, not 6-phosphate. Remember, and this fructose 1-phosphate directly will break into two molecules, dihydroxyacetone phosphate and glyceraldehyde only, not phosphate. Dihydroxyacetone phosphate and glyceraldehyde. This glyceraldehyde can be phosphorylated by different enzymes. That's different thing, and it will go into glycolysis, and through glycolysis it can produce fat. And glycerol plus fatty acid will make fat. So you know this. So these two enzymes, remember these two enzymes, because deficiency of this enzyme causes one benign disorder, and deficiency of this this aldolase B associated with a very severely actually debilitating disorders. The children will have a problem. Okay, hepatomegaly, jaundice, children will come with a problem with this enzyme deficiency. But if this is deficient, there will not be much problem. So this deficiency enzyme, aldolase B deficiency, is very important. AB deficiency, aldolase B deficiency. We will, let's see. So liver has a specific enzyme, you know, fructokinase and aldolase for the metabolism. We have already done, and it makes this fructose metabolism bypass this PFK1 step, which is a regulatory step. It is like metabolism of fructose is like uncontrolled horse going uncontrolled vehicle. The vehicle with brake fail. So you can imagine like a vehicle which has no brake. So this is the pathway of glucose is like vehicle with no brakes. Okay, you know it will cause accident. So you can see many accidents. If somebody takes too much of fructose syrupy fruit, like food, if somebody eats too much fructose syrupy food, so fructose is not good for our health. You will, if you don't take fructose, there will not be any problem. But if you take too much of fructose, it will cause many problems, because uncontrolled metabolism of fructose into this dihydroxyacetone phosphate glyceraldehyde and then free fatty acid, and fat will cause deposition, formation of fat, and that different type of this glyceraldehyde 3-phosphate will join together, will make a different type of difficult type of fat here. And you can see, because of very high amount of speed of this fructose metabolism, if you take too much of fructose comes from sucrose. Remember, sucrose, generally the source of fructose is sucrose. From one part is glucose, other part is fructose. So sucrose is table sugar that we take every day. Every food has this sucrose. Okay, so this fructose will cause very high amount of metabolism of fructose, will utilize ATP, very high amount of ATP, and this ATP will produce uric acid. ATP is nucleotide. Okay, this will produce AMP, and AMP will produce uric acid here. Lactate, uric acid, you know, the patient will have high uric acid, high lactate, and this deposition of fat in different vital organs. And that is why, because of this high fructose content, there will be slow but gradual damage to many organs. You can see that is what I want to convey from this slide. Fructose is very toxic, and I have also given this link. You can go visit this link and you can study how fructose is toxic. high amount of fructose normally is also toxic. But in condition where enzyme is deficient, it will be more toxic. You can see here. So you can see this patient, 6-month-old male, is brought to ER with recent onset of vomiting, irritability, jaundice. Okay, you can see vomiting, irritability, and jaundice. All of the vaccination are up to date. So no, there is no problem with vaccination. He has been exclusively breastfed. Okay, there is all exclusively breastfed until 1 week. Until 1 week ago, when cereals and fruit juices were introduced into the diet. So cereals and fruit. So after 6 months, generally we give the baby food. That is not actually the food that we give, the normal food. We actually start the food, normal grains and other things. We start adult, similar to adult. We start other food. So in that regimen, the baby was given fruit juice and cereals and into diet. So further evaluation revealed that hepatomegaly is there in child, and liver function test, abnormal liver function test. What are the liver function test? Enzyme test, AST, ALT. We will talk about that in this unit only. AST, ALT, bilirubin test. So you can see jaundice here. AST, ALT, bilirubin, and then other are protein tests. So this AST, ALT, bilirubin, these tests are abnormal in this baby. So which of the following enzyme deficiency is the most likely cause of the patient condition? Why did you choose aldolase B? Why is the B? Because I have already given you a signal here. Maybe because of that. So I have already given you this signal. The fructose disorder of fructose metabolism involves these two enzymes, fructokinase and aldolase B. And this is benign condition. If this is absent, what will happen? This fructose will be high. And fructose is, if fructose is high, fructose is permeable to cell. It is very permeable. So fructose will come out of the cell and it will actually go out of the body through urine. So this is why this fructokinase deficiency will not be a problem. And fructose is not our regular diet, which deficiency will result in something problematic. Okay, if this is absent, what will happen? Fructose has already converted into a very molecule. That molecule cannot come out of the cell. Cannot come out of the cell. This molecule will keep accumulating in the body, in the cell hepatocyte, keep accumulating. And I told you these molecules, you can remember like a grain. So many grains will accumulate. And you can imagine this molecule the same way glucose 6-phosphate accumulated in the liver. And that caused actually blocking glycogenolysis. So this will also do the same thing, block glycogenolysis, block gluconeogenesis. But the mechanism is a little bit different. So just remember this is the accumulated fructose 6-phosphate is toxic the same way glucose 6-phosphate was toxic in Von-Gehrke disease. So you can see here, this is the condition of hereditary fructose intolerance. So you can see here, this is because of deficiency of aldolase B. And it is autosomal recessive disorder. And because of that, there will be high fructose 1-phosphate in the body. You can see here high fructose 1-phosphate if this is absent. If this is absent, so there will not be further metabolism of fructose 1-phosphate. But fructose is converting into fructose 1-phosphate because of fructokinase. But fructose 1-phosphate is not able to further metabolize. Okay, so now, so fructose 1-phosphate is very high. Anything that is not permeable from cell becomes toxic. And this because of this, the same way glucose 6-phosphate caused inhibition of gluconeogenesis and glycogenolysis, it will cause hypoglycemia because of this. So hypoglycemia will cause jaundice because RBC require glucose. RBC requires glucose. No glucose, RBC dies, and death of RBC is anemia and jaundice. Okay, so remember, hemolytic anemia, hemolytic jaundice, and this is because of hypoglycemia. There is only fuel for RBC. The fuel is glucose. Now, because this glucose also will be deficient in brain, okay, hypoglycemia will also affect brain. So you can see vomiting, okay, you can see vomiting here, and fructose, this because of this vomiting and failure to thrive, brain will not get, your body, other part of body will also actually have deficiency of this, and because of accumulation of this fructose 1 phosphate, you can imagine this will cause hepatomegaly. So hepatomegaly explained. If you know nicely von Garker disease, it will not be that difficult to understand this. So you can see hepatomegaly here also. Here, diarrhea. Why diarrhea? Because fructose is digested but not metabolized. You know, something you take in your diet through intestine, and your liver is there, and here is the connection. Through blood, it is absorbed in the liver. So something you take galactose, fructose is there. Okay, you take fructose. Okay, fructose. If you take fructose, enter blood. Here fructose goes. So fructose is metabolized here. Fructose 1 phosphate, but this is not further metabolized. So what will happen? This will inhibit here, and this will inhibit here. So ultimately, diarrhea. The whole thing is linked. So that is why fructose is not metabolized. Fructose will not be absorbed nicely. And therefore, because you know fructose is a facilitated diffusion. So if fructose is high in blood, fructose will not be absorbed. And it will cause, high fructose will cause diarrhea. So fructose, diarrhea. You can see diarrhea. Actually, metabolism, if even in case of the galactose, if it is not metabolized correctly, it will cause diarrhea, because intestinal mucosa will also be affected because of indigestion. If it is not metabolized, everything is influenced. So diarrhea, you can see diarrhea. So because of this fruit juice and this sucrose, everything will happen. So you must have understood the problem. Weakness, hypoglycemic weakness, trembleness, sweating. You can see every problem related to this accumulation of fructose 1 phosphate. Now, did you understand what I said? Pathogenesis.
Yes, sir.
So we have correlated this to von Garker disease so that you will understand. And this actually, the main cause of all pathogenesis in fructose, hereditary fructose intolerance, is depletion of phosphate pool. Okay, this is the main cause of pathogenesis. Okay, remember, this is the main cause of pathogenesis. The pathogenesis is little bit different from von Garker disease. Depletion of phosphate pool is causing all the problem. So if questions comes, what is the cause of presentation that we see in hereditary fructose intolerance? The cause is underlying pathogenesis is depletion of phosphate pool. Okay, now you can see diagnosis you made by this activity, enzyme activity. You do enzyme activity, you do biopsy, and then treated by, if you restrict a diet, if you don't give the fructose diet to the baby, it is very easy to treat. It will be treated. So fructose is also not a necessary nutrition. That is why you can avoid and you can restrict, and patient will live a very good life. There will not be any problem throughout his life. Untreated, so patient will be in a risk of liver and kidney failure. Okay, if baby is not restricted with fructose, For example, in rural area, if diagnosis does not happen, the parents keep giving fructose, and then baby will die with hepatic and renal failure. So therefore, this is diagnosis is the treatment here. Your diagnosis is treatment. You diagnose, treated. No money is spent on it for treatment. So that is why in some disorder, genetic disorder, early diagnosis is very, very important. Okay, some genetic disorder, early diagnosis is very, very important. Diagnosis is treatment. So you can see here, phosphate depletion is cause of all problem. You know, glycogen breakdown is what? Phosphorylasis. If phosphorylasis, if phosphate is not there, how come this phosphate will be added here and glycogen will break? That is why glycogen is inhibited. Glycogen accumulate in liver, and then this is inhibition of glycogenolysis. Now, if there is no phosphate, no ATP formation, so ATP formation will also affect. And you know ATP is required for what? ATP is required for what? Gluconeogenesis. Pyruvate to glucose, you know, gluconeogenesis. And that is why hypoglycemia, both will cause hypoglycemia. This is the reason of hypoglycemia. So whatever may be the reason, this is the primary cause. Okay, so nobody knows what happens inside cell. This is the primary cause they have found. And you can associate the same way fructose 6-phosphate with glucose 6-phosphate, and you can memorize the way you memorized von Garke disease. No problem with that. So, but you have to just remember phosphate depletion is the main cause. This is maybe the secondary cause. Okay, so memorizing things is more important than. And hyperuric acidemia, uric acid, as you can see in von Garke disease, uric acid is very high. Here also you will see the patient is last long, so patient will have uric acidemia. Lactic acid is also there in von Garke disease. So lactic acid will also become high in such patients also. So they're very similar to von Garke disease. If you compare this with von Garke disease, you will remember better. And just remember, for the academic point of view, phosphate depletion is the main cause. Will you memorize this hereditary fructose intolerance?
Yes, sir.
Yes. And then an apparently healthy 23-year-old male is found to excrete large amount of fructose in his urine. Despite the patient's defect in fructose metabolism, dietary fructose can still participate in glycogen synthesis in these patients due to activity of
Fructose kinase.
Is it fructose kinase? Fructose kinase is absent. This is actually fructosuria, condition of fructosuria. Okay. This is the first enzyme deficiency. This enzyme deficiency. Because of that, fructose will be high and fructose will come into urine. Fructose in urine, urea. Fructosuria. Fructose in urine is fructosuria. So that is what this question says. So large amount of fructose in urine. So fructokinase is actually deficient. This is deficient. If this is deficient, there is no, you cannot think of this. So aldolism. And this is also not the case. And fructose is not an aldose sugar. So that is why it will not be reduced by aldose. Fructose is K2 sugar. So this is not, this will also not be the choice. See,
Sorry, I meant to say hexose kinase is not fructose.
Yes, tell me. Hexokinase?
Yes.
Hexokinase is the answer. And I'll tell you, hexokinase present in liver? It is not, but kidney has, so liver, it is not present in liver, hexokinase. So hexokinase is present in muscle. So muscle has glycogen synthesis. So glycogen synthesis will happen in muscle from fructose through this hexokinase. Hexokinase, fructose will convert into fructose 6-phosphate. And fructose 6-phosphate through this isomerase enzyme, phosphohexoisomerase, it will be converted into glucose 6-phosphate. Glucose 6-phosphate through mutase enzyme. Which mutase? Phosphoglucose mutase. Glucose 1-phosphate. Glucose 1-phosphate, UDP glucose. And UDP glucose into glycogen. Did you understand? Be quick to reply, please. Okay. So this is the condition. You can see this is fructosuria. Okay. So you can study yourself. This is rare genetic but benign condition. Okay. Defect is benign. Why is defect benign in comparison to hereditary fructose intolerance? Because fructose is permeable. Fructose 1-phosphate is impermeable.